We are in a climate crisis. It's also a health inequity crisis. Global warming and extreme weather events caused by climate change are directly affecting human health, in some cases claiming lives. That's why climate change has been recognized by medical and public health professionals as a health emergency. Extreme heat is the leading cause of weather-related deaths in the U.S. Here in the Pacific Northwest, the 2021 heat dome was the deadliest weather-related disaster in Washington state history, with at least 100 heat-related deaths, including 30 in King County. Climate change is also leading to longer and more frequent wildfires. The resulting air pollution has widespread health impacts, both short-term and long-term. Climate change also can damage critical infrastructure, such as transportation, energy and water systems, and supply chains. This can affect hospitals and other essential services like manufacturing, food production, and medication supplies. And these extreme climate events are becoming more frequent, more intense, and lasting longer. Climate change is the single greatest threat facing humanity. That's not just me saying that. The World Health Organization has stated that. Reducing fossil fuel emissions as quickly as possible is literally a matter of life and death. The reason I say climate change is also a health equity crisis is because the people most impacted by the climate change are those with fewer resources to protect themselves. Communities of color, low-income and immigrant households, people living unsheltered, outdoor workers, children, and the elderly. We know that people who have experienced environmental and structural racism are at increased risk for a wide range of poor health outcomes. Now, they're also at increased risk for suffering from health impacts of climate change. Healthcare systems play a critical role in responding to the health impacts of extreme weather events. What's less well known is that our healthcare systems are also major contributors to greenhouse gas emissions and global warming. At the same time, healthcare systems need to be resilient to the impacts of climate change on their operations in order to continue to serve their communities and provide essential care to their patients. We'll continue to see climate change-related power outages, flooding, and surges of patients into emergency rooms, as has happened previously during extreme heat events. And our healthcare systems also need to help patients prepare for and limit the current and future impacts of climate change on their personal health. Healthcare professionals play a critical role in responding to climate change. We can push to reduce healthcare's carbon footprint and develop sustainable practices in our organizations, building healthcare systems that reduce our negative impact on the planet. Healthcare professionals also play an important role as trusted messengers. We can deliver information on climate change and its health impacts to our patients, building their capacity to adapt. We need to invest more in climate change education, training, and capacity building for our healthcare workers. We need to build the knowledge and skills needed to recognize, prepare for, and respond to climate change-related threats. Public Health Seattle and King County is committed to helping our healthcare partners start and continue this important work. All of society, including the healthcare sector, needs to act with urgency to reduce greenhouse gas emissions and limit climate change while simultaneously preparing for its effects. There's a rapidly closing window of opportunity to secure a livable and sustainable future for all. By working together, we can make an impact to avoid the most catastrophic effects of climate change and improve the health of our community now and for generations to come.
Hi, I'm Brad Kramer. I'm the manager of the Climate Health Equity Initiative at Public Health Seattle and King County. We spent the past year or so working with our healthcare partners on how to do more at work in climate change, and I'm here to share with you some of the great things we learned with our partners. This will be done in 4 sections. The first section is mitigation. This is how our healthcare systems are becoming more carbon neutral. Section 2 is data and strategic planning. We're going to talk about how we brought health and climate data into our community health needs assessment. Section 3 is preparedness and response, how we can support our healthcare system to become more resilient during climate-impacted events. Section 4 is adaptation. This is how we can support all of our healthcare partners, clinical providers, insurers, their patients, their communities, to adapt to climate change now that it's here. You can also check out our website, and you'll find a series of companion resources that can help you get started There's no bigger challenge than climate change, and we need to work together on this. I hope you find some knowledge and some inspiration from our guests over this talk. Thanks for joining us.
My name is Srini Pandikatla, and I'm the Sustainability Director at Seattle Children's. I'm here today to talk about mitigation in the healthcare sector. What is mitigation? When we're talking about climate change, mitigation means reducing and stabilizing levels of greenhouse gas emissions, or GHGs, in our atmosphere caused by the burning of fossil fuels. You might also hear the term carbon footprint, because carbon dioxide is one of the major gases contributing to global warming. Nationally, the greenhouse gas emissions produced by the healthcare sector account for 8.5% of total emissions in the US, so it's a significant amount. Globally, healthcare emissions are estimated at 5%. The US has the highest emissions per capita among industrialized nations. This image shows some of the many ways that healthcare contributes to climate change, including energy used to run buildings, many of which operate 24/7 year-round, employee commuting, supplies and equipment needed, and the resulting waste generated from patient care. When we break down the numbers, we can see that the bulk of healthcare emissions come from the supply chain. That means the production and distribution of items and services that healthcare systems need to provide care to patients. This includes medical supplies and devices, medication, and administrative services, among many other things. So how can healthcare systems reduce their carbon footprint? The top 3 actions that health systems in the US are taking include starting a green initiative, switching to LED lights, and reducing waste. A green initiative can also be known as the Green Team. It brings together staff focused on sustainability to identify actions and bring momentum to change. Switching to LED lights is a relatively simple action that reduces how much electricity you can use. In most of the country, that electricity is powered by fossil fuel sources. However, in King County and the Pacific Northwest, that's less of the case since our electricity is powered by hydroelectric and other more sustainable sources. Lastly, reducing waste means that less ends up in landfills, where it would produce methane over time. Methane is another greenhouse gas, and it's about 30 times more potent than carbon dioxide. Here are some other actions that healthcare organizations can take. Broadly reducing energy use in the building, and specifically in the operating rooms, as they are a particularly resource-intensive area. Using alternate transportation methods, King County Metro and Sound Transit are great alternatives to driving alone, and educating workforce members, patients, and the community on becoming more sustainable focused. I'd like to talk a little bit now about what we're doing here at Children's. Seattle Children's mission is to provide hope, care, and cures to help every child live the healthiest and most fulfilling life possible. We are committed to improving the health and well-being of our patients, families, workforce, and community, and that includes promoting a healthy environment and our impact on it. Our first goal is to become carbon neutral by 2025 at our hospital campus here in Seattle. Carbon neutral means to cancel out emissions by purchasing what are known as carbon offsets. This money goes toward funding carbon saving or carbon reducing projects off-site, such as investing in new renewable energy facilities. Now, there are many categories of emissions to think about. The EPA calls them Scope 1, 2, and 3 emissions. Scope 1 are directly occurring emissions, mainly from burning fossil fuels like natural gas to run buildings or gasoline to drive fleet vehicles. Scope 2 emissions are indirect. They're derived from purchasing electricity. Scope 3 is also indirect supply chain emissions, such as goods and services, waste, commuting, business travel, and more. Our goal is to offset all our Scope 1 and 2 emissions and some of our Scope 3 emissions, namely our business travel and employee commuting. Since 2018, we have also offset 10% of emissions with the tree planting partnership with the local nonprofit Forterra. Being carbon neutral means we're taking responsibility for our current operational impact on environmental health, while at the same time, we continue to decarbonize operations to meet net zero goals. We have signed on to the Health and Human Services Healthcare Climate Pledge, which is a voluntary commitment to cut our emissions in half by 2030 and be net zero by 2050. That means by 2050, we would not produce any emissions from our operations, whether through efficiency or using renewable energy sources. How are we doing so far? Since 2018, we've reduced the relevant carbon neutral emissions categories by nearly a quarter, and overall emissions by 10%. Mostly that has happened by optimizing building operations to consume less natural gas and reducing purchasing in some areas. This is during a period where we expanded our hospital and opened a new wing, the Forest B building, which added about 30% more square footage to our site. So even with increased energy use and resources needed from that expansion, we've still managed to reduce our emissions significantly. Here are a couple of things that helped us succeed. For one, it's important to have data to understand the scope of what we're doing. We have many ideas of what to do to reduce our emissions, but utilizing a data-driven approach helps us be more strategic. We can see where opportunities are to have the most impact, and we can measure change from a baseline as we implement new programs. Second, sustainability partners with a lot of different departments throughout the hospital. This includes facilities management, environmental services, food services, transportation, clinical teams, and sourcing, to name a few. The real change happens in the day-to-day work of each individual department and person. That means you need collaboration and buy-in to the team and organizational goals. It really is a group effort throughout the hospital. So how can you take action? It depends on where you are in your own climate journey as a healthcare system. If you're just starting out, forming a green team is a good place to start. Education is also important to make sure all staff is aware and on board with your new programs. For example, you can put compost and recycling bins all over the hospital, but it won't help much if staff don't know how to use them, how to sort properly, or where it goes once collected. Finding data is important to quantify your energy consumption and fossil fuel usage through utility invoices. And if you've already done those things in your organization, some intermediate steps include strategic planning around your GHG reduction. Build support and find champions at all levels of your organization, and stay on top of local legislation. Some state and local city legislation has driven our planning needs. Others are voluntary commitments. Lastly, join Practice Green Health or another healthcare sustainability organization to learn more and support your own sustainability journey. We are constantly learning from each other. Each health system can do a lot, but we can share knowledge and lessons learned and encourage each other to create lasting systemic change.
I'm Ailey Joseph, and I'm an epidemiologist at King County Public Health. The work of our team involves tracking and monitoring population health and the social determinants of health. So you just heard about how it's important for an organization to track their emissions data or to see how those numbers change over time. Another kind of data that's important to track is population level data on how climate change impacts people's health. So our team in public health has gathered data on key indicators of climate impacts on health. These include things like heat and cold-related illness, asthma, allergic disease, vector-borne disease, and food and waterborne illness. This data is publicly available, so anyone can view them on our new climate and health dashboard. By tracking this data, we can monitor the impacts of climate events on our community as they become more frequent as well as more severe. For example, if you take cold-related illness, analysis of emergency department visit data shows a 60% increase in ED visits due to extreme cold in just a 2-year period, and a 20% increase in ED visits for asthma in just 1 year. Similarly, in 2021, many of us will remember the unprecedented heat wave that swept the Pacific Northwest, and so during just a 7-day period, we saw 100 deaths across the state. So by tracking this data, we're able to bring visibility to these impacts like we haven't been able to do before. Not just that, we can also see who is most impacted and what disparities exist, because we know that adverse health outcomes are not uniformly distributed. For example, when we look at ED visits for extreme cold, we see that compared to the county overall, American Indian Alaska Native residents and Black residents are between 4 and 5 times as likely to visit the ED due to cold-related illness. The lack of stable housing is another very well-known, huge risk factor for cold-related ED visits. Similarly, the rate among older residents, especially those over 75, are double the overall county rate. Another example is ED visits due to asthma, which is exacerbated due to wildfires and extreme weather. So when we look across geographies in King County, we see some zip codes in the southern part of the county having rates 4.5 times as high for ED visits compared to some other zip codes in the north part of the county. So we really want to get into the weeds of this data and see where and on whom are the disproportionate burdens of climate change falling. So one of the first places we've used this climate data is in the 2024 to 2025 Community Health Needs Assessment, or the CHNA. A CHNA is a very comprehensive document. Every 3 years, we take a deep dive health profile of King County and our diverse communities. The goal of this document is to understand what has changed over time, what has gotten better, what has gotten worse. We also want to know what are the health disparities we're seeing. Are they getting worse? Are they getting better? And they built and shaped this document along with us. This informs their strategic plans as well as some of the investments that they make in their communities. This latest CHNA includes, for the very first time, a chapter on climate. The narrative on climate change also talks about community members' experiences, including how extreme weather events have impacted mental health and food access. So in this document, we have combined quantitative as well as qualitative data to tell this story. I do think this is an important step. Only a handful of CHNAs from health systems across the US include any data indicators or narrative about climate impacts on health. So for a health system that comes face to face with hundreds of thousands of people every day, this makes it kind of a blind spot and a missed opportunity. We can already see that climate change will continue to have broad and far-reaching health implications for our communities. So it's very important to gather this data and make it visible to entities that can actually leverage it for action. In fact, we need more CHNAs across the US to incorporate climate and environmental considerations. It can help our healthcare systems in their strategic planning around climate change. But there are also so many other organizations and sectors that benefit from this document. It can help city, county, and local governments know where to focus efforts and create policy priorities. That includes a lot of program implementation work that happens in our very own health department. Nonprofits and community organizations that don't have the resources to do a health assessment can also use this document in their planning work as well. In addition to the CHNA document having a chapter on climate change, at the health department, we've also included climate change indicators in our routine health surveillance practices as well as systems. This is what we call our community health indicators. I see this as our leaders in public health committing to investments in making the surveillance of climate impacts part of our standard practice, which is great. Of course, health systems can take environmental actions to reduce their own footprint, like auditing their energy consumption, switching to low-emission vehicles, all of which are really important. But they could also benefit from knowledge about the changing patterns in healthcare usage. That will help them be prepared for what we may very well continue to see, which is rising morbidity and mortality due to extreme weather events and other impacts of climate change. So if you're an organization that's looking to prioritize investment in health or climate planning, I encourage you to check out our CHNA as well as our climate dashboard.
Hi, I'm here with Honor Lean, the Executive Director of the Northwest Healthcare Response Network. Thanks for joining us today.
Thanks for inviting me. I'm happy to be here.
What is the Northwest Healthcare Response Network and what do you all do?
Well, the Northwest Healthcare Response Network is a nonprofit organization. We lead a coalition of healthcare organizations, healthcare providers, along with public health agencies and emergency response agencies, all working together to help ensure that our healthcare system is getting ready and more prepared and more resilient for any kind of public health emergency or disaster.
What does preparedness look like in terms of climate emergencies in the healthcare setting?
It's similar or the same to what a healthcare organization might need to do to prepare for any kind of emergency. So for example, we want healthcare organizations to have robust emergency plans and think about all the different kinds of hazards that they might need to respond to. We need them to think about what are the steps that they need to take to make sure they can continue to provide care to their patients. Or if there are more patients because of the emergency, how are they going to surge? We need them to have good communication plans. So how are they communicating with their staff, with patients, and their community response partners? They should also be thinking about what kind of supplies do they need to respond to an emergency. All of those things are important components for any kind of emergency. But if we think about climate hazards, we really want organizations to be understanding what are the hazards that are most likely to affect them. That might be wildfires, that might be floods or heat-related responses. So organizations should really be assessing the hazards and the climate hazards that are most impactful for them and thinking about what might be different So are there different supplies that they might need to respond to those hazards? Are there different training elements that their staff need? Are there things that might affect their operations differently, like if there's a lot of wildfire smoke, how are they thinking about air quality? Or if there's extreme heat, are they thinking about the impacts of that heat on their air conditioning or their equipment, like their X-ray machines? Are they thinking about messaging that they need to communicate to their patients? All of those are some additional steps that organizations can take to help prepare for climate-related emergencies.
Walk us through an example, like the 2021 heat dome, where we had excessive heat for nearly a week and early in the spring and summer season.
Yeah, we learned a lot during the heat dome of 2021. So there are some important steps that organizations can take, and some of them are similar to things that I just mentioned. So we want organizations to be making sure that they've assessed what the impacts might be to their supply chain, as well as to their equipment, like X-ray machines, like computers and data and all the technologies that healthcare organizations rely upon. We want them to be thinking about the impacts to their patients, and if they can be proactively messaging things to their patients, helping to push out public health messages, helping to ensure that their patients understand what might be things that put them at higher risk due to heat that could make them more vulnerable, and what steps can they take to help reduce that impact. In particular with heat, it's folks with chronic disease, the elderly, or young children. And then when we get into a response, we need those organizations to activate their emergency response plans, implement any steps that they need to take in order to respond to surge, and we need them actively engaged in the community's emergency response. And we're very fortunate in this region that healthcare organizations and the hospitals are so collaborative in working together. So we will have regular conference calls, regular coordinating meetings where they're getting together, they're sharing information with all of us about what their impacts are, what their capacity is, are they seeing unusual trends or types of patients that are coming in. They'll be identifying and working with public health to help us identify, are there new things we can do to mitigate the impacts on the community. So as a part of their preparedness, they have to be working internally and also be prepared to be coordinating externally. And that response coordination will happen until the emergency has ended.
Thank you. So how do healthcare systems work with public health during a climate emergency?
So a lot of that collaboration starts in the preparedness time. So identifying what those hazards are, what are the areas of most risk to patients in our community, and what steps can the healthcare system and our response be taking to mitigate those impacts. When we respond, healthcare has an important role in sharing information with public health. So if it's something because of a disease, there's information around disease trends and the number of patients that healthcare might be seeing. If it's a heat-related emergency, ensuring that they're doing all of the appropriate reporting on heat-related illness and impacts that they're seeing in terms of patients coming to their organizations. If it's a wildfire, being prepared and coordinating with public health, both on steps they can take to protect their organizations, but also sharing information about impacts they're seeing to their populations. And I can't overstate enough the importance of healthcare being a part of those trusted communicators that can help get out public health information about different risks and what impacts they might have to vulnerable populations and steps people can take to protect themselves. And we really need all providers and all healthcare organizations supporting public health and being a part of that messaging to their patients and their communities.
And if you're part of a smaller clinic or health system with fewer resources, what are some options for you?
There's good tools and good templates, tip sheets, and various things that can help organizations that don't have a lot of resources work on some of the basics in terms of their own organizational preparedness. I think it's really important for any size organization to think about what its role will be. How are they going to communicate with their patients? How are they going to communicate with public health and emergency response agencies? Have they identified what their staff roles will be, and have they trained staff on what those expectations and those roles will be so that they can continue to provide patient care when their patients in the community need it most? We really need providers and healthcare organizations, large and small, helping to communicate that public health messaging with their patients so that we can hopefully reduce the impact of injury and illness on our most vulnerable and everyone in our community.
And my last question, where can one get more resources about this?
Well, the good news is there's so many organizations putting out good resources. So I'd have to say my organization has some. Public Health Seattle King County, the King County Emergency Management Office, the State Department of Health and Emergency Management, as well as a lot of resources from our federal partners at the Centers for Disease Control and Prevention. There's a lot more resources coming to bear these days. And so a lot of things that healthcare organizations can access to help them prepare and respond effectively.
Well, thank you, Honora. That was really helpful and informative. And if folks want to learn more, please check out their website at nwhrn.org.
Hi, my name is Christopher Chen, and I work as a medical director for Medicaid at the Washington State Healthcare Authority. HCA administers the state's Medicaid program, also known as Apple Health, which covers over 2 million clients in our state. We value our partnership with Public Health Seattle and King County and share a dedication to addressing climate change, which is why I'm here today to talk about how healthcare systems can help our community adapt to climate change and share work going on at Public Health. What does adaptation mean in this context, and how does it differ from mitigation? You've already learned previously that mitigation is about reducing greenhouse gas emissions to minimize the healthcare sector's impact on the planet. Adaptation can be defined as anticipating, preparing for, and responding to the health impacts of climate change. We recognize that climate change is a reality that we need to live with and that we have to adapt to. Climate change is already impacting people's health. You might have experienced this yourself if you have found yourself having asthma symptoms during a wildfire smoke event, or if you've noticed your seasonal allergies are getting worse. And these impacts are projected to increase in the future. Your local public health department, health systems, and the broader healthcare sector all play a critical role in supporting frontline communities that are already experiencing the effects of climate change. Their job includes building internal knowledge of climate change and its health impacts, informing and preparing patients and broader community, and providing physical resources to reduce risks to health. We'll talk about 3 steps all healthcare systems can take: risk communications to residents, providing protective equipment, and provider education and resources. Risk communication is meant to give residents the information they need to make informed decisions about their health during a hazard. In this case, a climate-related health hazard. Here are some real-world examples. This Stay Safe in the Heat comic was co-developed with community partners. It describes the health impacts of extreme heat, who is most vulnerable, and what protective actions to take. It has been translated into over a dozen languages, and the past few summers, the graphic has been run in a campaign with multilingual and community media outlets to get information out to our most impacted community members. Public Health's Climate Changes Health comic was also co-produced with local Seattle area artists. It highlights the major effects of climate change, its health impacts, and recommends actions to both mitigate and adapt to climate change. And it's done in a clear, visually interesting format. Communications materials like these can be given to residents and patients in their spoken language to help inform and educate. This can help people make the connection between climate events and health issues they may be experiencing, like asthma or allergies. To help our community adapt, though, we need to do more than just provide information. People also need protective equipment and resources, such as box fans or HEPA filters or air conditioning units. Let's take wildfire smoke as an example. We know that having a HEPA air filter in the home is the most effective way to filter out harmful smoke particles and protect our health. So for the past couple of years, Public Health has distributed a cost-effective DIY solution to clean indoor air, a box fan filter kit. They've partnered with community organizations to distribute thousands of these kits to residents. Another adaptation example from our region is the Oregon Medicaid Waiver Program. It's the most assertive measure from a Medicaid program to fund climate change and health adaptation resources for populations at greatest risk. Starting this year, some Oregon Health Plan members may qualify for what they call climate supports, which are devices that help keep people safe during climate events. These may include devices that provide clean air and healthy temperatures, including air conditioners, heaters, and air filters. Mini fridges to be able to keep medication cold during a power outage. Portable power supplies to use during a power outage to be able to operate medical devices like ventilators. Patients do need to have a certain health condition to qualify for these supports. For example, they need to have a health condition that gets worse during hot weather to qualify for an air conditioner, or a health condition that requires temperature-controlled medication to qualify for a mini fridge. Lastly, let's talk about the importance of our healthcare providers.
They are consistently seen as the most trusted messengers for health information, which creates an opportunity to have these conversations with patients to build their capacity to adapt. Do patients know what their risk is when extreme heat hits? Do they know how harmful wildfire smoke is and how to filter their indoor air? To be able to have these important conversations, providers need a solid understanding of climate change and its health impacts. These are 3 great resources aimed at providers that teach exactly that. The Climate Resilience for Frontline Clinics Toolkit by AmeriCares has downloadable resources for patients, providers, and administrators on heat, wildfires, hurricanes, and flooding. Climate MD is from the Harvard School of Public Health. It's a hub for climate change and health research, education, and training for health professionals. A Physician's Guide to Climate Change, Health, and Equity was developed by the Public Health Institute. It gives a foundational understanding of climate science, health equity, the role of physicians in climate change and health, and more. Another example of an initiative to address provider education is one that healthcare authority is involved in, the BREE Collaborative Work Group on Health Impacts of Extreme Heat and Wildfire Smoke. This group plans to formulate multiple recommendations for payers, providers, public health, and others in the healthcare space to cohesively respond to extreme weather events. Meetings are open to the public and we welcome you to participate. Information on attending is available on the BREE Collaborative's website. Thank you for taking the time today to learn about how risk communication, protective equipment, and provider education are key measures to address adaptation to climate change.
Thanks so much for joining us today and taking the time, but there's still so much work that can be done. We'd like to continue this partnership. Please do reach out to me and our team. Please let us know how we can support you to find resources and to do more work together.